Good afternoon, I'm Michelle Murray
And I'm Monica Free.
and we are final year dietetic students here in Worcester.
So today we're just going to speak a bit about what is a dietitian and a bit more about our studies as dietetic students, and especially here in Worcester. So as we said, my name is Monica Free and I'm a fourth year dietetic student from Stellenbosch. We are completing our fourth year here in Worcester as part of our studies.
And it's also the rural clinical school, so it's more based on the rural communities here in Worcester.
Yes. So just to briefly discuss what is a dietitian. So a dietitian is a healthcare professional who focuses on proper food and nutrition in order to promote good health. So we look at an individual from their nutrition and we try and focus on treatment from a nutrition standpoint.
Yeah, so as Monica said, we work with people and food, so we live and breathe food actually, and also the effect that food has on your body. And we are experts in nutrition, and therefore we promote good health and guide and counsel people on eating habits and also lifestyle habits, so not just eating but also lifestyle as a whole.
So our program here in Worcester, especially as dietetic students in our fourth year, differs. We have lots of different blocks, specifically community, therapeutic nutrition, Oquanda, which is a combined block, and then food service management, which is the three fields that dietetics focuses in.
And research.
And research. And so what we do here on a daily basis, we involved a lot in the communities. We do community development there. We do consultations with patients, whether it be chronic patients with diabetes or hypertension or cholesterol, or even pediatric patients. We also work in the hospital here in Worcester, where we have worked in the wards with patients who are more acutely ill. And then, so we work in food service units. We work in all the different aspects of dietetics while we are studying here in order to gain more practical experience before we've released out into the world after our degree.
Okay, so just like why we decided to study dietetics is I've always seen the value that food can have on your health as a preventative measure but also therapeutic. And yeah, there's a saying that says everyone's business but no one's responsibility. So I think it's really an honor to be able to take the responsibility and also help people to have the right information and evidence-based information regarding nutrition.
Yeah, I decided to study dietetics because I saw the impact that healthy eating and a balanced lifestyle and good nutrition had on my life, not just from a medical and a nutritional point of view, but overall my well-being as a person. And I realized that I could combine my love for working with people and my desire to help people with my love for nutrition and for food, and dietetics was the perfect marriage between the two fields for me. So that's why I decided to become a dietitian. So as we said, the three main areas that a dietitian works in, so there's community nutrition. So this involves mostly consulting with patients at your local clinic. We participate in community development programs where we help to strengthen the community and the resources that they have. And we also educate patients on different lifestyle conditions that they might have through group consultation sessions or health promotion talks. Then the second part is therapeutic nutrition. So this is more clinical nutrition, in which we provide a patient with a diet prescription suited to their individual and specific needs based on their disease condition. This can also involve monitoring a patient's condition, so if they are acutely ill, to monitor it with regards to their nutritional status, and then developing therapeutic menus for a hospital or for them to take home. And then the last one, which is often unknown, is food service management. So this is most often in a kitchen where a dietitian can help to develop specialized menus for certain diets, as well as to help with the management and the operational capacities of a kitchen on a day-to-day basis. So those are the 3 areas.
And one of the questions was, what diet would be prescribed to a patient with type 1 or 2 diabetes, and also the who wants to gain weight that has HIV or AIDS. And this is very specific to each patient, so it's difficult to give advice if you don't have the patient in front of you, because each person has a specific need. But we usually just advocate for the food-based dietary guidelines. That's what the government set up. It's like a few steps that you have to follow to be able to have a healthy diet, a healthy lifestyle, and to have optimal energy and nutrition. And also then the food plate model. It's difficult to explain it now, but you can Google it. The food plate model is the ideal portioning and the way that your plate has to look for optimal nutrition.
I think it just involves healthy eating for everyone. I think we all know what healthy eating is. So, and a lot of
physical activity.
A lot of these resources can be found on the ATSA website and online. There's a lot of good resources about the South African food-based dietary guidelines. So, just to speak a bit more about being a dietetics student. So, for me personally, what I found to be one of the most rewarding things is being able to help people with the knowledge that I have been taught by my lecturers and by my professors. And for me, it's that seeing the lights go on in someone's eyes, that moment when they see that the recommendations that I've made and that they have adapted in their life, the positive changes that it's brought in their life, to see that moment of that sense of pride that they feel.
And to empower them.
To empower them. I don't think there's anything much like that moment when those lights go on. That's one of the most rewarding things for me about being a dietetic student.
Yeah, and some of the challenges of a dietetic student, nutrition is very diverse, and it has actually like a finger in the pie in every politics, economy, health. So it's a very diverse degree, and now that we study it, we realize how it's not just you give someone something to eat, it's very diverse, and it's also very complicated. So, and also the influence that media has on nutrition is extremely big, so it's difficult to always convince someone that something that's in the media and that's so prevalent at that time is not actually evidence-based. So I think that's also a big challenge, is the media itself.
So then lastly, we're just going to speak about, or very briefly, about what our long-term plans are for our next 5 to 10 years. So we are completing our studies this year, and then next year we have our community service here, which we work in different facilities all around South Africa. And then, so mine is, I truly want to become a dietitian who can inspire people to live their best life and give them the capacity and the abilities to make not only their diet an essential part, but an enjoyable part of their lives. And preferably I would like to do this overseas a bit, but then also bring back knowledge and skills that I've obtained from my travels back to South Africa and bring it back to our lovely abode, and to try and bring back the knowledge that I've brought from these countries where this knowledge is, and to try and implement it here in a South African context.
For me, for my shorter term goals, is I would love to do my master's, so to study further and to study in a specific field. But I have many interests and I'm passionate about many aspects of dietetics. But that's okay for me, because I think in the next 2 years I will definitely discover what my niche or my passion is. So I'm very excited to discover more of dietetics.
So we just want to say thank you for listening to us today.
Hope you enjoyed it.
Hope you enjoyed it.